Hi, my name's Sam. I'm one of the nurses from the Public Health 5 to 19 team. Today I'm going to talk about routines and behaviour. As children grow, most will test the limits. This is quite normal behaviour. Rules can help you keep your child safe, but as they get older, you may find that your values conflict with theirs and you'll need to negotiate boundaries and let them take more responsibility for their own safety. Try not to set too many boundaries as this can cause resentment and can be impossible to maintain. Work out what is really important to you and what you could let go. Prepare your child for the routine. Don't let the first day of school creep up without warning. The weekend before, explain to your child that he or she will be returning to school again soon. Take the preparation one step further by reinforcing bedtime. Much like our minds and bodies need time to readjust to our sleep patterns, kids need it too. Getting them to bed early will make the Monday morning wake up call much easier to handle. Also, get back to your routine. Kids look at our behaviour much more than we realise. If you are reinstating your own bedtime and setting your alarm to wake up early each morning, chances are your child will fall back into their routine much easier. Is your child tired? Are you tired? Expect that after a late night or the holidays, routines may become temporarily unsettled. Tiredness can manifest as hyperactivity, a shortened attention span, and a lack of interest or motivation. Eating regular meals helps to regulate our blood sugar. This may influence some of the hormones that control our mood and ability to concentrate. For this reason, poor mood and behaviour are often observed in children who have been without food for too long. For example, children who haven't eaten breakfast. Some children have food intolerances, which can mean that their mood or behaviour are affected by specific foods or ingredients. These can produce physical symptoms too. If you are concerned that your child is intolerant to certain foods, it's best to discuss this with your GP. Some signs of dehydration could be feeling thirsty, dark yellow, strong smelling wee less than usual, feeling dizzy or lightheaded, feeling tired, dry mouth and lips or tongue, sunken eyes. Dehydration can cause tiredness and irritability in a child. As well as the obvious signs of dehydration, such as feeling thirsty, dark yellow, strong smelling wee, a dry mouth, lips, and tongue, a child can also have sunken eyes, a headache, feel dizzy or lightheaded, or become tired and irritable. If you struggle to get your child to drink enough fluids, speak to your child's school to see if they can support and encourage him fluids throughout the day. Also, on hot days, you could give ice lollies, jellies, and watery fruits such as melon, as they can be good for hydrating a child that doesn't drink much. Also, make sure to offer a drink each meal time for the child. Be sure to allow enough time for your routine and don't rush your child. This allows time for them to develop their independence. Sometimes kids don't follow a routine because it's too stressful to get it done in the set time frame. Do a run through to see exactly how long it takes. If you need your child to get dressed, eat breakfast, pack up, and get out of the door in the morning, try it on a day when you aren't in a rush. If it takes 10 minutes longer than you planned, then go back and allow that time. Be sure to prioritise what's important. It all feels important, but if you and your child are fighting every night about doing the dishes right after dinner, maybe they can be done a little later or first thing in the morning. Postponing the extras can cut back on the stress and the bad feelings. It takes time to learn and get used to new routines. Don't expect to see a change right away. Instead, keep an eye out for small improvements. Keep giving gentle out loud reminders and pointing out the written schedule. If your child is having trouble, it's okay to help. And remember to praise the effort, not just the end result. Trying to follow a routine is much better than just not following it at all. Nearly all children will respond to illness by behaving differently. Sometimes they act younger than their age, for example, by crying more, wetting their bed, or becoming more clingy. They might become anxious, panicky, sad, frightened, or more irritable and annoyed and angry about things. Or they may have sudden changes in mood which are hard to predict. They might refuse or find it hard to go to school or have trouble sleeping and become very tired. Others react by getting too active and find it hard to relax. All these reactions can be a result of the child expressing their feelings, especially if they cannot understand what is happening to them or find words to describe how they feel. Family issues such as mental health, sibling illness, learning disability, or family disagreements can result in changes in behaviour such as distress, irritability, and agitation. Every person is different, but people with a learning disability may be particularly vulnerable to negative life events and might not have the mechanisms for coping with these. Children's behaviour and routines may be affected by life stresses such as moving house, parents separating, attending a new school, or a family bereavement. But it is important to try and continue with routines as far as possible, although the child and family may not be able to follow the routines during a time of stress for the family. It's important to try and stay positive and seek support throughout those stressful times if it's required. It is very important to notice when your child is being good. It is tempting when they are playing quietly to get on with jobs and not take the time to notice their good behaviour. We can all fall into the trap of giving children lots of attention when they are misbehaving. When your child is behaving in a way you like, give them some positive feedback. Giving praise to a child as soon as they begin to perform the desired behaviour works very well. Giving praise within 5 seconds of the positive behaviour is most effective, especially when you are trying to promote a new behaviour. The Solihull programme gives some good tips and can be accessed free by all parents if more advice is needed. Sometimes there is no obvious reason that your routine doesn't go well, and it can be frustrating trying to figure out why. It is easy to blame yourself or blame the child, but this doesn't help with the routines or the behaviour. On these occasions, it's important not to give up, but just to start a fresh day the following day. If you feel that you need additional support with any concerns regarding your child's health and well-being, then you could speak to your GP or make an appointment with eSchool Nurse to talk through your worries so that further assessment and support can be given.